Regular visits to an optometrist should be part of everyone's ongoing health regimen. Optometrists can be found in almost every community in Ontario, and no referral is necessary to make an appointment. When patients arrive at their optometrist's office, they are greeted by a receptionist who confirms their personal information. After checking in, an optometric assistant may perform preliminary tests using high-tech automated equipment. These devices measure the shape of the eye, give an estimate of a patient's prescription, and measure the fluid pressure inside the eye. These measurements provide valuable information to the optometrist when developing a profile of a patient's overall vision and eye health. At the beginning of every exam, the optometrist will undertake a detailed case history to learn what the patient's main visual concerns are and to fully understand their personal situation. The optometrist will ask about any eye-related symptoms and inquire about the general health of the patient and their family, including details about medication and recent surgeries. There will be a discussion of a patient's visual needs, both for work and recreation. The optometrist will then measure how well a patient sees with their current eyewear by having them read an eye chart in the distance and up close. Following this, there is typically an assessment of a patient's eye coordination. If the eye muscles that control the position of the eye do not work well together, a patient can experience eye fatigue, blurred vision, and even double vision. By identifying these problems, suitable remedies can be incorporated into their eyewear and eye exercises can be suggested. During this part of the eye exam, optometrists are keenly aware of any dramatic changes to a patient's eye coordination, which could be a sign of more serious systemic diseases such as diabetes or thyroid problems. The refraction is the part of the eye exam that the optometrist is best known for. Careful testing will determine the appropriate combination of lenses that will focus the image on the back of the eye and offer the best vision possible. As well, the optometrist will take into consideration any specific needs that a patient may have and may prescribe eyewear for special uses such as computer work or hobbies like needlepoint. Following this, the optometrist will utilize their arsenal of highly specialized instruments to perform a thorough check of the inside and outside health of the eye. This is arguably the most important part of the eye examination, since this assessment will uncover any sight-threatening conditions that may be present. Often, patients are unaware that they have an eye disease, since many conditions, such as glaucoma and macular degeneration, have very few symptoms in their early stages. The eye exam is also modified to consider the unique needs of certain patient groups. For children, more emphasis is placed on checking the development of the child's visual system. Children should have their eyes examined by an optometrist at the age of 6 months, again before they start the kindergarten, and annually thereafter. The optometrist spends more time with younger patients checking their depth perception, color vision, eye tracking, and eye coordination. Parents may not be aware that their child may have eye problems such as lazy eye, which is best managed when caught early. As well, subtle problems such as poor eye coordination can profoundly affect a child's ability to learn, since 80% of learning is visual. Contact lens wearers require annual assessments to monitor the ongoing health of their eyes. Additional detailed testing of the front surface of the eye, eyelids, and tear film is required to determine if the lenses are fitting properly. Poorly fitted or dirty contact lenses can cause eye infections and reduce the flow of oxygen to the front surface of the eye. Seniors should have their eyes examined at least annually, since the risk of developing sight-threatening disease increases as we get older. Optometrists pay particular attention for the early signs of age-related conditions such as glaucoma, macular degeneration, and cataracts. Optometrists are committed to helping patients understand their eye health and will explore options to help them remain active and independent. People with diabetes are another group that require annual eye examinations. Diabetic retinopathy has few symptoms in its early stages but can result in blindness if not properly managed in a timely fashion. Optometrists pay special attention to the internal eye health of these patients. For patients at risk for glaucoma, an extensive workup is performed, including a detailed assessment of their side vision. When necessary, patients are counseled on management plans to reduce the risk of vision loss in the future. At the conclusion of every examination, the optometrist will review the results and make diagnoses based on the findings. The patient is counseled on the status of their eye coordination, eye health, and the need for glasses or contact lenses. If a vision therapy program is recommended to improve eye coordination, the optometrist can design and provide one. Optometrists may also offer low vision services to the visually impaired, helping them to maximize their useful vision and maintain their independence. Many optometrists also offer the added benefit of purchasing eyewear and contact lenses through their office. The optometrist is often the best person qualified to provide these services as they have a full understanding of the patient's visual needs. Typically, an optometric assistant will help the patient select a frame and provide useful information on lens options. Ultimately, it is the optometrist who determines if the choice is suitable. Patients interested in contact lenses can choose to purchase them through their optometrist. The prescription is often not the same as the eyeglass prescription, since additional factors must be considered in order to ensure a proper fit and optimum vision. New contact lens wearers are taught to insert and remove the contact lenses, as well as how to take care of them properly. Reordering contacts is only a phone call away. Eyeglasses and contact lenses are dispensed at a reasonable cost, and optometrists are happy to provide follow-up service. Optometrists are committed to ensuring patients receive the best eye care possible. Your good health includes good vision and healthy eyes.